Hi, I'm Dr. David Josephitis. I'm a diplomate of the American Board of Hair Restoration Surgery, and today I'm going to be discussing beard restoration. Now, many of you may not be familiar with beard restoration. Many of you may only have heard of hair restoration surgery and think that it only pertains to the scalp. But actually, we can repair and improve areas of the face, the beard, the mustache, eyebrows, and even eyelashes. Today we'll be discussing mainly beard hair restoration. It's an exciting field, and I look forward to talking with you about it. Who is a candidate for surgery? Anyone who has ever desired to have more hair in the beard or mustache area could potentially be a good candidate. Many patients come to me because they've just never been able to grow a full beard. They may have spotty or sparse growth in certain areas and just want to have a more uniform appearance. Also, some patients have lost beard hair from trauma, chemical burns, scars from procedures. So the beard restoration is actually an excellent way to bring back density to areas that are thinner or to cover scarred areas that the patient currently has. An important aspect of beard restoration is that the grafts or the hairs that we use for donor actually come from the scalp. So they're a non-renewable source. So it's important to consider, if you're a candidate, it's a good idea not to have other types of hair loss. Potentially patients come to me with very early male pattern hair loss, and they're also requesting a beard surgery. I discuss with them about potentially maybe needing surgery for the future for their scalp, because right now they don't want it, they don't need it, they'd rather have beard. But in the future they may have more loss up top, and they may not have enough hair to do both the beard and the scalp. So this is a very important discussion to have with your physician. So where does the donor hair come from? Well, it can come from two sources actually. First of all, if the beard restoration or mustache restoration is very small in size, perhaps a scarred area here or potentially around the face, very small areas, we could potentially use beard hair grafts for the beard restoration. A good source of that donor actually can come from under the chin. This is an area that, although is part of the beard, is not typically as important as the other sides parts of the face. So we can actually obtain quite a few hair grafts from under the chin. Typically, patients who have hair under the chin, we can recommend anywhere from 1,000 to 2,000 grafts may be available there. So that might be enough for a small session. But in general, the majority of the donor hair actually does come from the back and the sides of the head. And the grafting in this area is typically taken from either the FUE procedure or the strip harvesting procedure. Of course, if that smaller procedure was done under the chin, that would be done via the FUE procedure. So what about the technique? How is it actually done? Well, when you come to visit us in the morning, we would discuss the general plan, and I would help you design the beard or mustache area that you would like. We would talk about appropriate looks and what would work well on your face. Sometimes it's nice to bring in photographs of other beards that you like, either on online or in magazines that you've seen, and we'll design that for you. When we start the procedure, we remove the grafts from the back or the side and the sides of the head. Once those grafts are taken, I will make incision sites on the face in the same angle and direction of your surrounding beard hairs. Once we have those incisions made, we will actually place individual grafts in those directions using either fine forceps or implanter pens. We use very high magnification loops so we can make sure those grafts are placed in there in a nice, careful angle and direction. Even curvature is also very important with beard hair transplantation. Now, what about the care of the grafts after surgery? Well, after surgery, we have to be very careful not to disrupt or dislodge any of the grafts. As you may or may not know, the grafts are held in place by very small scabs and can be easily removed by bumping or any strenuous activity, which is why for the first 3 days we recommend no washing of the face. After that, we will recommend for the first week to wash very carefully using a very careful rinse method, no direct shower pressure. Also, for the first week to 10 days, we encourage you to stay away from any strenuous activity which might cause those grafts to bump out or become loose. After the 10 days, you can slowly resume normal activities and normal face washing. Now, what can you expect after surgery? Well, it does take some time to grow in, approximately 9 to 12 months before you're going to see the completed result. At that point, you will be undergoing normal shaving and trimming of the hair. A lot of patients wonder, if they'll have this full, robust beard after one session. And I typically tell patients that, depending on what their ultimate outlook is for the goal, rather for the surgery, we recommend typically more than one session in order to just increase the density. It may not be obvious, but we can only put so many grafts so close together on the face, and that density may or may not be sufficient for you for one session. So we typically recommend patients to at least be aware that they may need more than one session in order to get them to that density level that they feel comfortable with. So I hope this has helped you learn a little bit more about beard restoration. I appreciate your time. Thank you.